Here, what we've done actually, we cut or we open, we open the right ventricle, next to the paracoronal interventricular groove here completely. At the same time, we cut also and open the pulmonary trunk, as you can see. Why? It's just because I would like to show you the internal structures of the heart and the valves, which we can see inside the heart. So once we open this, as you can see here, first, let me just tell you that internally there we have what's called the ventricular septum. The ventricular septum is a very thick muscle, or muscular structure, located between the left and the right ventricle. This is here the interventricular septum. So now we are inside the right ventricle. And if you remember at the beginning of this video, we said that from the right ventricle, we have here the pulmonary trunk. So we opened the pulmonary trunk, as you can see here, to be able to see the internal structures. So if you allow me, in order to see other structures deeply there inside the right ventricle, including, for example, the tricuspid valve there. In this case, we have to cut this muscle, or this muscular fibers extends, between the septum and the lateral wall of the right ventricle. Again, from the lateral wall of the right ventricle to the interventricular septum. This is what's called the trabecula. The main function of this is to keep the wall of the right ventricle, close to the interventricular septum, and in this case, it's like a continuous of the papillary muscle in the wall of the septum. So if you allow me, I would cut it now to be able to see or to describe the different structures inside the right ventricle. So we cut it, and now, before talking about the tricuspid valve, let's look at this valve located in this area between the right ventricle to the pulmonary trunk. This is what's called the pulmonary valve. So what is the name of this valve? Here is the pulmonary valve. As you can see, this valve here, the pulmonary valve, has these three structures here called the semilunar valvula. These three structures, or what's called the semilunar valvula, located exactly at the beginning of the pulmonary trunk, they allow the blood to move from the right ventricle to the pulmonary trunk. At the same time, they prevent the blood from coming back from the pulmonary trunk toward the right ventricle, as you can see here. So in this case, the blood, if the blood moves from the right ventricle toward the pulmonary trunk, this valvula, so we name them valvula, semilunar valvula, will be just pushed to the wall of the pulmonary trunk, just like this, and allowing the blood to go to the pulmonary trunk and from there to the lung. The blood cannot come back, because once the blood comes back, this blood will fill these pockets here completely, in the way that they will close the opening between the pulmonary trunk and the right ventricle. And in this case, the blood cannot go. Let me show you this, well, in this view here, in this view, like this. Doctor, I will take this one, and you will take the other two. Can you? Please, thank you. So, as you can see here, the blood will fill these pockets completely, or this semilunar valvula completely, and there's no way for the blood to go back from the pulmonary trunk to the right ventricle. What is the name of this valvula? So we have three of them inside, to form this valve. We have the left semilunar valvula. We have the right semilunar valvular, and here we have the intermediate semilunar valvular. We have actually something similar to this between the left ventricle and the aorta, called the aortic valve. So to be able to see the tricuspid valve there, I would continue opening the right ventricle. So here, I would continue on the way. We will see another, some muscular fibers or muscular bundles between the interventricular septum and the wall of this is another one here, the wall of the right ventricle. So we will open the right ventricle completely here, and now we can see this valve there. Let me continue a little bit here. We can see this valve, called the atrioventricular valve. Atrioventricular valve, or what's called here in this situation the tricuspid valve. Why atrioventricular valve? Because it's located exactly between the right, in this case here, the right atrium and the right ventricle. That's why we would name it also a right atrioventricular valve. Or in the book you will find another name called the tricuspid valve. Tricuspid because we have these three structures there, named cusps. So we have 1, 2, 3, and that's why tricuspid valve. So this one next to the interventricular septum called the septal cusp. This one here is the parietal cusp, and this one here is the angular cusp. So again, that one next to the septum is the septal cusp, that one toward the wall is the parietal cusp, and that one here in between is the angular cusp. So tricuspid, that means 1, 2, 3 cusps. So the tricuspid valve, allow the blood to move from the right atrium there to the right ventricle. But after that, it will prevent the blood from moving from the right ventricle toward the right atrium. So if the blood want to go back or to run back or to move back, in this case, the cusps will be also filled here with blood, and at the end they will be closed exactly this way here, that the blood doesn't have way to go back to the right atrium. To achieve this goal, you will find that each of these cusps is fixed to the wall of the ventricle, or exactly to a specific area, specific muscle found in the wall of the right ventricle called the papillary muscle. This is the papillary muscle, so the cusp is fixed to these papillary muscles by what's called the Chordae Tendineae. Chordae Tendineae. So this tendons here, all of these tendons called the Chordae Tendineae. Chordae Tendineae, to fix the cusps, to the wall of the right ventricle. So here we have the tricuspid valve. We will look at that one located between the left atrium and the left ventricle, called the bicuspid valve. Why bicuspid? Because here we have 3. There we will find that we have just 2 of such structures, cusps, and so I will open the left ventricle and come back to you. See you soon. So we're back. As you know, we opened the right, ventricle. After that, as promised, I opened the left ventricle next to the barocona interventricular roof. So firstly, let me show you that this is here the ventricular septum. This is the ventricular septum. It's really very thick. Okay, so now we are inside the left ventricle. The left ventricle, again, here we can also find some of the trabecula here extends between the septum to the wall of the left ventricle. This is all trabecular, just to fix, the wall toward the heart. I will cut all of them later to be able to show you some of other structure. I opened also the aorta at this level. So the aorta, as we explained before, starts from the left ventricle. And as described, we said that between the left ventricle and the aorta, we have another valve. This one here. It has also three valvula, semilunar valvula. Three of them. We have the left, the right, and the septal valvula. So this is 1, 2, 3. So they form together what's called the aortic valve. So this is here the aortic valve. Exactly in the same way we described before. This allow the blood to move from the left ventricle toward the aorta. As you can see here, once I put my hand here, I will push this valvula to the wall like this, so allowing the blood to go to the aorta. After that, if the blood want to go back, in this case the blood will fill completely. So can you take this tool? Yes, please. Yeah, the blood will fill completely this valvula here, and this will close the opening between the left ventricle and the aorta. So what is the name of this? Between the aorta and the left ventricle, the aortic valve. Let's stay at this level here. I will show you, as I told you before, that at the base of the aorta, here we can see the two openings to the left and right, coronary artery. So this is one here. I hope it's clear. This one here. This is the right coronary artery. And we have another one here. This is the left coronary artery. I will show you. So this is the opening. In one view, you can see the opening of both coronary arteries. This is the right coronary artery, and this is the left coronary artery. What's happened if you put something inside this coronary artery? For example, once we cut actually the connection or open the ventricle, the left ventricle, we cut, of course. Or we went through the coronary groove where we described that we can find the coronary artery. This is the left coronary artery moving inside the coronary groove. So let me just push this way here, and this is how the coronary artery moves inside the coronary groove. It was like this, exactly, we cut it in the middle. And as you can see, the left coronary artery responsible to supply the left ventricle, in this case, has its opening from the aorta at this level here, after the aortic semilunar valve. Directly, if we follow the aorta here, we can see the second, after these two coronary artery, we have this very big opening. Look, I can put two fingers here. So here we're talking about the brachiocephalic trunk, which is responsible from the name brachiocephalic. Brachio from brachium for the forelimbs, cephalic for the neck and head. This is the brachiocephalic trunk, and after that it moves, caudally to supply the rest of the organs and muscles in the body. Okay, let's go back to the left ventricle. And as I said before, I would like now to show you the bicuspid valve. Perhaps I can keep this here, but let me just cut this one here. And I will try now to show you the two cusps of the bicuspid valve. So this is one. And that is another one here. If you can see it, okay? So we have just two cusps here. The septal and, the other one here, the parietal. The septal toward the septum and the parietal toward the wall of the left ventricle, okay? So just two cusps, and that's why we will name this as bicuspid valve. So bicuspid valve. So let me cut this structure here. This is one of the Chordae Tendineae. So let me cut it. Chordae Tendineae, very strong tendon to hold the cusp, to the wall of the ventricle, and exactly where to what's called the papillary muscle. This is the papillary muscle. It's a big muscle found in the wall. Here we have one, and here we have one. They will just cut one of these Chordae Tendineae. It's really very hard even to be cut, And after that, they will just separate it here and to show you exactly, the opening here, between the left ventricle, left atrium and left ventricle. In the same way, exactly in the same way, here this valve is responsible to allow the blood to come from the left atrium to the left ventricle, but at the same time to avoid the blood from going back from the ventricle to the atrium. So comes in, but it's not allowed to comes back. Comes in, not back. In, not back. Okay? And all of this again, what is the name of this? Strong tendon, Chordae Tendineae, to the papillary muscles. I hope everything is clear now. So here once again, we are inside the left ventricle. So we open the left ventricle here at the base of the heart between the aorta and the left ventricle in the wall. Exactly there, we can find a fibrocartilaginous structure in all animals, but here especially in the ox, this fibrocartilaginous structure is very developed and it forms what's called the os cordis. So it's a bone actually found in this area. I just tried here to show you the bone by removing some of the soft tissue surrounding the bone. So as you can see, we can find this bone at the base of the aorta, inside the wall and inside the septum. Inside the wall and inside the septum, the wall of the left ventricle and inside the septum. And, this bone will support the opening to the aorta, will support the aortic valve. So, as you can see, we can palpate this bone in the wall there. So I just dissected part of it here. This is the bone, the os cordis, and we can palpate it at the base there. And also, it's very strong actually in the ox here at this level here. It's somehow rounded. It moves into the ventricular septum, the way that we can even palpate it from the right side inside the right ventricle there. I can palpate it with my finger there, so that means it supports also the right atrioventricular valve, or what's called the tricuspid valve there. This is here what's called the os cordis, very developed in the ox and even the camel.